Having just reviewed the metabolism of alcohol, let's go back and look at some of the steps involved in this process and perhaps gain a better understanding of why alcohol causes a toxic reaction in the body when consumed in large amounts. A product of alcohol metabolism that is more toxic than alcohol itself, acetaldehyde, is created when alcohol in the liver is broken down by the enzyme alcohol dehydrogenase. The acetaldehyde is further broken down by another enzyme, acetaldehyde dehydrogenase. Don't worry, you don't need to remember this enzyme. But what you do need to know is that this enzyme, along with some other compounds in the cell, create the non-toxic acetate or acetic acid, which is a substance very similar to vinegar. And this is how the body detoxifies alcohol. The process usually works pretty well, leaving acetaldehyde in the system only for a short period of time to do its damage. A short period of time meaning when only a few drinks are consumed. Unfortunately, the liver stores of the chemicals needed to detoxify alcohol quickly run out when large amounts of alcohol enter the system. This causes acetaldehyde to build up in the body, leaving this toxic compound in the system for long periods of time. We'll talk about the medication Antabuse in a little bit, but for now, let me say that the medication works by blocking this second enzyme, allowing the buildup of acetaldehyde. I'll tell you about some of the pretty uncomfortable effects of having acetaldehyde build up in your system when we discuss treatments of alcohol. Along with the toxic effects of acetaldehyde buildup, now let's look at how alcohol affects our liver. The first type of liver damage is called fatty liver. This is when deposits of fat resulting end products of the metabolism of alcohol build up in the liver. This can occur even after one single bout of drinking. What's happening is that the liver is unable to process the fat, and it builds up and causes these blobs that you see in this picture. This condition, however, is reversible. You stop drinking, the body needs that fat for energy, and it metabolizes it. However, if you continue to keep drinking, you may progress to alcoholic hepatitis or liver inflammation. Symptoms of this condition can include fever, jaundice, which is when the eyes and the skin turn yellow, abdominal pain, nausea, fatigue. It can occur both from chronic and binge drinking. Quitting can reverse the damage, or it may progress to alcoholic cirrhosis or cirrhosis of the liver. This refers to scar tissue building up in the cells in the liver. This is not a reversible condition. While you cannot reverse the damage of alcoholic cirrhosis, you can halt the progression of disease by stopping alcohol consumption. Fetal alcohol spectrum disorder is associated with alcohol during pregnancy. This condition is actually more common than autism. It's associated with growth deficiencies, microcephaly, which means small head size, small eyes that are sometimes crossed. The muscles that keep the eyes from crossing are not well developed, flat mid-face and a blunt nose, heart defects, and urinary tract defects. In addition to the physical abnormalities that occur with fetal alcohol spectrum disorder, there are many other problems, including seizures, IQ ranges from very low to hopefully above average, struggles with abstract concepts, and difficulty generalizing knowledge and experience, since the brain isn't developing well as a result of being bathed in alcohol during fetal development. The child with fetal alcohol syndrome has trouble processing concepts. These include cognitive and behavioral issues, resulting in slow learning, poor memory and problem solving, impulsive, short attention span, and poor social judgment. There are indeed some benefits associated with light drinking. Ethanol may cause a small increase in the healthy cholesterol, the HDLs. There are also antioxidants, plant chemicals found in wine that have been shown to improve HDLs and possibly inhibit blood clots. These are resveratrol and flavonoids. These plant chemicals can also be found in other foods that may not be as fun to consume. But what we need to remember is that excessive drinking raises blood pressure and raises blood triglycerides, which can counteract any positive effects associated with alcohol consumption. Problem drinking is a behavior that impairs the life of the drinker as well as those who are around that drinker. It's not necessarily the same as alcoholism, but it is a type of alcohol abuse. You don't have to be an alcoholic to have problem drinking. But alcoholism is when the person becomes dependent on alcohol. Some may be more susceptible to alcoholism than others. There is a genetic susceptibility to alcoholism. The disorder is characterized by strong physical and psychological cravings for alcohol, and the body changes how it responds. There's a biological craving or tolerance for alcohol, resulting in withdrawal symptoms when the person stops drinking. These withdrawal symptoms are sometimes referred to as the DTs, or delirium tremens. These symptoms include extreme restlessness, sweating, disorientation, and hallucination. Perhaps you've heard of the phrase hair of the dog. This is when the person has a drink the next morning to get rid of these symptoms. I want you to think about what may be actually occurring. Are they getting rid of the symptoms, or are their tissues simply becoming saturated with alcohol once more? The first step in the treatment of alcoholism is to recognize that you have the problem. There are a number of treatment options, including detoxification, often involving a residential or in-house program, Alcoholics Anonymous, psychotherapy and counseling, and then there are medications or pharmacological treatments. I mentioned earlier the medication Antabuse that goes by the name disulfiram. This medication actually causes acetaldehyde toxicity. In studies that blocked the enzyme that converted acetaldehyde to acetic acid, acetaldehyde toxicity occurred within minutes of having a drink. And the results included severe headaches and vomiting. And these symptoms, these were so bad that even the alcoholics in the study were wary of taking the next drink. The person who is prescribed Antabuse is supposed to take it before they drink so that it's in their system and causes acetaldehyde toxicity. Basically, I think it's kind of a behavioral conditioning so that you associate drinking alcohol with headaches and vomiting. Recognizing that you have a problem is often the most difficult hurdle to overcome. But once you've been able to do this, developing a behavior change plan can assist you with reducing your consumption, and these are some of the suggestions that go along with behavior change plan. It's also important to have a strong social network. This is not something that a person can do on their own very easily.